So I was diagnosed with HER2 positive breast cancer, and I was scared, and I didn't know where to turn or what to do next. I went to the Weill Cornell Breast Center first and foremost because of a phone call. We had heard of Dr. Ann Moore through a bunch of people, and my husband emailed her, and Ann Moore called. She reassured us. She said, "Don't worry, I've got you," and I knew I was going to be okay.
The Weill Cornell Breast Center, we realize as that patient arrives that every patient is different and every patient is unique. They may all have the diagnosis of breast cancer, but each breast cancer is different and each patient is different. And we recognize that right from the beginning and work to make the most of that situation.
Almost every patient we see at the breast center has a customized program. We are more and more using precision medicine to better characterize the individual tumors.
Every tumor that walks through our door, with the patient of course, is genotyped. So that means that we really get down to the nuts and bolts of the tumor, and we really want to understand what caused this tumor to evolve.
And that helps us make treatment changes based on the specifics of each woman's breast cancer.
We're moving away from the one-size-fits-all therapy to an individualized approach to treatment.
So we've been in breast cancer way ahead of the game as far as personalized medicine. All of our physicians are actively involved in research. We are designing some of the studies that are being given nationwide.
There's still a lot of patients out there who have their cancer come back, who are living with stage 4 breast cancer. And the only way that we are really going to reduce relapse, increase cure, is to do clinical trials.
If you can be in a clinical trial and get standard of care plus, you may be getting drugs that are not going to be available to the general population for maybe 10 years.
Clinical trials are no longer a last resort. We have clinical trials for every stage of breast cancer. We really believe in a multidisciplinary approach to patient care. As a medical oncologist, I work with a team. I work with the surgeons, with the radiation oncologists, with the geneticists.
We all work together to ensure optimal patient care.
The main things I'm looking for is the latest medication, the latest technology, and Weill Cornell has it.
2 or 3 years ago, we put together a program with a cold cap in which an ice cap is put on women's heads during the chemotherapy.
Cornell has the largest scalp cooling program in the New York area, where we allow women undergoing chemotherapy to use scalp cooling to prevent hair loss associated with chemotherapy. We put in time with our patients. We get to know everything about her.
We think about them a lot, not just in the 15-minute follow-up visit. We are involved in their lives and in their care.
Call up and immediately I'm seen, I'm cared for, I'm treated as if I'm a family member.
I had my last chemo yesterday, and when I'm walking out there, I mean the loving, the kindness I got, it's like I'm leaving home. You know, saying goodbye to people that care for me, and it really touches me.